Hello, everyone. Welcome to another episode of FitRx. I'm your host, Dr. Greg Dennis. And as many of you probably know, if you've listened to any of my podcasts, I am a fan of low carb. I talked a little bit about a keto-ish type of a diet in my fat burning lecture. And through all that, the last year or so, I discovered something called the Carnivore Diet, which is what it sounds like. It's all animal meat, animal organs type of a diet, with no fruits, no vegetables, no grains, no sugars. And as radical as that seems, when I first heard about it, I thought the same thing. But the more I've learned about it, the more I believe it's really a healthy way to eat. And I have started recommending that to more and more patients. And so I will invite you just to keep an open mind as you listen to this episode. And we definitely have an expert in this topic on the show. And so my guest today is Dr. Shawn Baker. So he is a physician, graduated from Texas Tech Health Science Center. He went on to be an orthopedic surgeon, graduating residency from the University of Texas. He worked overseas as a combat trauma surgeon. He was the chief of orthopedics in the United States Air Force, multi-sport athlete. He's been on multiple podcasts, including Joe Rogan and others. And so I'm super stoked that he's here today with me. He is also effectively known, at least on the internet, as the Carnivore King. So Dr. Baker, welcome to the show.
Hey, Dennis, thank you for having me. And thanks for giving me the opportunity to reach your audience.
All right. So I always like just kind of hearing your story. I mean, how did you're a working orthopedic surgeon, and then now you're known as the Carnivore King. And so kind of tell us just how you got here to writing a book called, about the carnivore diet.
Yeah, I think like many physicians, we've been woefully inadequately trained on the impact of nutrition on health, at least most of us. And you don't really think about it until you kind of, I got, I guess, early to mid 40s. And I noticed that my personal health was not where I wanted it to be, despite just aggressive training. I mean, training at the highest levels as an athlete. I mean, I had literally just won a world championship in the sport of Highland Games, which is, these big guys wearing kilts, throwing, cabers, which look like telephone poles, and shot putting. And so I was a big, strong guy training very hard, all while doing surgery, which was, kind of a balancing act. But so I go through this sort of nutritional sort of self-education with self-experimentation over a period of, I bet it was about 6 years of just kind of trying progressively, different thoughts, reading different books, looking at different research, trying out these different diets. And I ended up getting low carb about 2 or 3 years in, and then kind of went from a paleo low carb and then eventually to a ketogenic diet. Spent about 2.5, 3 years there, and then got exposed to these crazy, wacky people doing all meat diets. I thought the same thing. Oh, this sounds kind of interesting, if not crazy. And I kind of open-mindedly, because I had already kind of read enough about nutrition to realize that it's not particularly well done science. And in some, it's just the inherent limitations in doing human nutrition studies. You can't do studies and control it like you're supposed to in a scientific experiment, and then kill everybody at the end and cut them open and see what happened. I mean, that's just not what you can do with humans, at least not ethically. So we have this very sort of poor quality science being put forth as somewhat definitive when it clearly is not. And so I was open-minded enough to do that. And then, I said, well, this sounds interesting. I'm going to try it for a period of time. And I did it, a couple days. I basically have a carnivore meal, eggs and bacon, steak and eggs for breakfast. Did that all day long and I felt pretty good. And then I said, well, I'm going to try it for 3 days now, and then 4 days. And I started looking back as an athlete, looking for competitive advantages, and I've always been kind of a guy I've always been a drug-free athlete, never took steroids, even despite, heavy weightlifting and stuff like that, and competing in strongman and powerlifting and, top level rugby and so on and so forth. But I looked at Vince Gironda's diet of steak and eggs. It was basically steak and eggs. It was 4 days in a row of that and 1 day of a carbohydrate refeed. So I started doing that. And then I realized, I just felt better on the steak and egg days. The carbohydrate refeed days, I just noted a lot of GI discomfort and inflammation, and I just didn't, and energy level was not as good. So I got the courage to try it for longer. I went 1 week, 2 weeks, and then finally in 2016, I went for a whole month doing nothing but, animal-based food. It was basically meat, but I mean, I think I had some eggs in there a little bit to some degree, and really felt just tremendous. I mean, I was like, wow, this is really interesting. And because 30 day was over, I said, well, I'm going to go back to my more sort of balanced diet, fruits and vegetables, in the low carb, ketogenic, and I just didn't feel as good. I mean, the aches and pains that had gone away, and this is at age 50 at this point, um, came back very quickly within a day. And I said, well, this is not something that I like experiencing. I prefer to feel good all the time. And so I ended up just kind of persisting in the diet. 6 months in, I got 100 people to try it online. We did a little kind of informal study where we got 100 people that were willing to do it and record their data. We did this called N equals many, because everybody's saying, well, it's just N equals one. It doesn't count. It doesn't matter. I said, well, let's get a bunch of people and call it N equals many. And 100 people did it for 90 days. And, the average person lost something like 13 kilos, which is about 30 pounds, and 8 centimeters off their waist. And every subjective measure, again, we didn't have any money, so it was all basically a lot of subjective stuff, but everything got better for those people. Their heart rate went down. We tracked things like bowel movements and erections in men, and just whatever people were willing to put down there. And it was across the board a success. And so this got the attention of, I guess, Joe Rogan. And then I got on his podcast. And then, it just kind of just kind of blew up from there. I mean, you get that exposure, and I wouldn't say half, I'd say 90% of the people think you're an absolute wacko crazy person. 10% think, yeah, maybe there's something there. And then 1% of the people try it. And, fast forward now 4 more years later, and now we've had tens, if not hundreds of people, thousands of people try it. And by and large, the vast majority, not all, but the vast majority of them are noticing significant improvements in health. And we've had some people with just amazing, literally, just sort of, blow the doors off transformations and health recoveries, things like, autoimmune diseases, people with, lifelong or nearly lifelong or decades long disease, depression, just get better. I mean, they return to life, which to me is just truly fascinating. I think it deserves serious inquiry and scientific study. And that's one of the things I'm trying to do, as you may be aware.
Sure. So how long have you been doing carnivore now?
So I am about to hit 4 years.
Wow.
I'm a few weeks away from 4 years.
Wow. And so what's been the biggest improvement, I guess, for your health?
Well, I wasn't like significantly sick going into this, but I mean, I think for what I saw, a ketogenic diet seemed to help with a number of things. The thing that really shocked me about a ketogenic diet, it was kind of an epiphany moment, was this hunger appetite suppression. I was like, wow, I'm not even hungry. And prior to that, I was, man, if I could go 2-3 hours without eating, it was pretty tough. I mean, because I was a big guy. I mean, I was consuming a lot of calories, and I still consume quite a bit of calories, but I mean, it was just, I was always wanting to eat something. And, that was a shock. But what I saw was, number one, digestion. I mean, it suddenly became, I didn't even realize I was digesting things, and I use this analogy, like I said, if you and I were to start breathing and we had lung chest pain or whatever, we would clearly say, hey, that's not right. There's something wrong there. Or if you go and you walk up and down the stairs and your knees start hurting, there's a problem, right? That's clear. However, when we eat and then we have, stomach pain, discomfort, bloating, gas, distension, we think, well, that's just normal digestion, I mean, because we're so used to it. I mean, this is just what it is. But what I saw was a profound absence of any of that. I mean, it was to where you didn't even know you had eaten anything. It's like there's no rumbling, no distension, no bloating, basically no gas, which I thought was just curious. But you think about it, I mean, does it make sense that we have an organ system or, a bodily system that causes us discomfort? And why would that be? It doesn't make sense. So my sort of thought on that is either you are eating the wrong food or there's something primarily wrong with that organ system. There's something wrong with your digestive tract, or the food you're eating is just the wrong fuel for you. And so, but the other thing is, I had, as an orthopedic surgeon, I had this chronic quadriceps tendonitis in my right quadricep. I remember I had it, I remember I was squatting 500 pounds one time and I felt a little bit of a tear. I thought I had like a partial quad tear. quad tendon tear. You know, I had my partner check me out. He's like, no, well, it seems to be intact, but it bothered me, and it bothered me for 10 years. And every time I worked out or ran or sprinted, it would be sore for a day or two afterwards. Within probably 2 months of doing the diet, the pain completely went away, and it has never come back, which I thought was something. I suffered with this for 10 years, and knowing all the tricks that you can do as an orthopedic surgeon to help with tendinopathy, I couldn't get it better. But carnivore diet, and I was like, wow, 2 months later, I'm like, it's gone. And the fact that it stayed gone for now 4 years is really neat. Athletic performance was another thing. I mean, I went, I'll just from a number standpoint, I remember I was trying to deadlift 405 pounds, and my goal was to hit it for 20 times.
Wow.
And I was like 45. I was trying to do that, and I never could do it. I mean, I would get to 15, 16, and that was it. I mean, no matter how hard I tried, I stopped. I went on a carnivore diet. The second week I was deadlifting, I hit 20 reps. It was just like my strength just went up like significantly. And I was just like, this is shocking. And I was older, and I wasn't changing anything training wise. It was still the same trying to training schedule and regimen, but just the proper high quality protein and nutrition and absence of probably things that were, detracting from that led for better performance.
And I'm assuming you monitor, your blood and lipids, which, we're going to talk about here in a second, but I mean, all your blood markers are good, inflammatory markers, all that kind of stuff.
Yeah. I mean, I'm not as much of a biohacker where I have to, analyze 7,000 things and check them monthly. I do periodically. I mean, I recently checked my LFTs. All of them were, low normal. Everything's fine. My kidney function completely fine. Although I do have to say that, and this is something that many physicians don't realize, when you're on a high protein diet, or you have a lot of lean muscle mass, or you work out hard and you're breaking down and turning over a lot of muscle mass, that'll artificially elevate your creatinine. And GFR is calculated based on creatinine. It doesn't matter. That's why the African American score is always 10 points higher, 13% higher, because there's assumption that they have X amount more muscle mass. And so what I do is when I assess my my GFR, and it's an estimate. You're not measuring it directly unless you want. There are direct measurements, as I'm sure you're aware, but most people get an estimated score based on creatinine. Well, if you use something called cystatin C, you get this GFR that is not confounded by those other factors we talked about: body size, muscle mass, protein intake. And when I did that, it was like 118, 120, which is completely normal. This is despite eating 3, 4, 5, sometimes 600 grams of protein a day, which is a hell of a lot of protein.
Wow.
I mean, far more than what we're told is typical. But
yeah.
So yeah, I mean, everything's been fine. My coronary artery calcium scan was a 0,
Wow.
Perfect 0. I had that checked in a couple of years into it.
Okay.
I'm going to move to a place. My computer is about to die. I need to plug it in. So hang on just a second. Bear with me. I'm going to mute this and walk around. So hang on. Hopefully maybe you can edit that.
Yeah. I'll edit it out. Yeah.
I'm back. Sorry. I just had
That's all right.
I was going to die in battery. So it's good for 2 podcasts, but not 3, I guess.
Yeah. Yeah. That's crazy. Yeah. You're probably tired of talking today.
No, that's fine. Talk today.
All right. So I'm sure people are probably, whether they're listening to this in their cars or wherever, they're screaming, oh my gosh, you have to have fruits and vegetables. You can't live without fruits and vegetables. Our mom's always told us you got to have 4 to 6 fruits and vegetables every day. So what do you say to that?
Well, I mean, obviously you don't need it. I mean, I'm not only me, but I mean the thousands and thousands of people that have done this without problem, without difficulty for years, in many cases, even several decades. In fact, there's one guy who did 50 some years before dying in a car crash at the age of, I think, 75, 76. But, we think about it, if we look at the modern dietary recommendations, and now it is 5, I think it's even 10 servings of fruits and vegetables a day on top of the 11 servings of grain we're supposed to have. You think about the plausibility of that, I mean, not today, but if you were just to turn the clock back, say 100, 150 years, not even, if we went back further, 20, 30, 40, 50, 100,000 years ago, but even 150, 200 years ago, all the fruits and vegetables that we're supposed to eat, this balanced diet, this eat the rainbow, this multiple colors, where would you have ever gotten that from? I mean, most of those things aren't even found in the same region. I mean, if you think about your locale, and then in many cases, these foods are not even grown on the same continent. So, I mean, this modern dietary recommendation is based on basically an impossibility, and it's only through year-round, massive transportation, that we can do that. Refrigeration, all these things that we never had access to. If we look at the human, what the human diet is supposed to be. So, unless you were living in the tropics, and most of us didn't for most of the time we've been on Earth, you have to realize that for the 3 million years humans have existed. When I say humans, I mean going back to Homo habilis, not just Homo sapiens, but we were in Ice Age for most of that time. The vast majority of that time was Ice Age time. That's one of the reasons one of the evolutionary pressures that drove us from out of the trees and stop eating fruits and leaves, and then into hunting and scavenging, and then hunting, driving the brain growth. And, it's not until, I don't know, 50, 60,000 years ago when we had this massive megafaunal, mega herbivore die-off over hunting, environmental changes, climate change perhaps, that we had to start, relying again on smaller animals and higher amounts of plant food to get our subsistence from. But humans are, clearly meant to eat meat. We thrive on meat. Our digestive system, our anatomy is, made for that. I mean, I know that people say that we don't have claws and fangs and can't run super fast, but I mean, we have the greatest weapon of all, which is our human brain ability to communicate, organize, and, fashion tools, which made us the greatest hunters on the planet. I mean, there's no other creature out there that has eaten every animal on the planet. I mean, there's sharks. Sharks clearly are vicious killers, but they don't eat cows. They don't eat lions. They don't eat monkeys. And likewise, lions don't eat, seals or, any of that stuff. And humans have eaten all that. I mean, we are the apex predator of the planet. But, I'm just wondering, if you say fruits and vegetables are necessary for our survival, or even to say we thrive, and I would say neither of those are necessary, but name the vegetable or fruit that grows in every region of the planet all year round in all seasons. And then I'll tell you the necessity of that. But I don't think you can name one. Maybe grass, perhaps, if you dig down. Maybe we should all be eating grass.
Well, what about, I mean, obviously there are a lot of greens that have antioxidant properties, and fruits, have a lot of vitamins. And so are we going to miss out on those things?
If you like, one thing we know is we have antioxidants. We make antioxidants. We have things like glutathione, superoxide dismutase, even uric acid is an antioxidant. I mean, we have this really robust endogenous antioxidant system, and quite honestly, it works very well. We have these reactive oxygen species. We have this certain amount of oxidation, and then the antioxidant system, and that's in balance. And we see a lot of, even there's a lot of studies when we see, particularly in the form of vitamin supplements, when you take in, these antioxidants, there's a lot of studies show that they're actually deleterious in the long term. So that this antioxidant theory of aging and disease has kind of fallen out of favor. That sort of theory is 30, 40 years old, and it's been kind of more or less disproven now. And we also know that many of the antioxidants in fruits and vegetables are denatured, destroyed, don't even get absorbed. The absorption rates are minuscule. And typically, what we see in many cases, some of these plant compounds, these phytonutrients, basically act as hormetic stressors. And so what they do is they're actually low-grade toxins, and they basically upregulate, our liver enzymes, much as like an alcoholic or someone drinking alcohol. The first time you drink alcohol, you're lightweight or whatever, and you get inebriated very quickly because you're just not used to, you can't detoxify the alcohol. But anybody know that's dealing with an alcoholic, I mean, they can sit there and drink and drink and drink and not even experience the effects because they've had upregulation of their alcohol dehydrogenase and some of these other defense mechanisms. So what we're seeing is these plant compounds generally show a benefit by, basically low level toxicity. It's not that they have some unique quality beneficial property. And also that toxicity, while it may help in some area, it may hurt in other areas. The classic thing is, perhaps like goitrogens. We eat these cruciferous vegetables because they have things like sulforaphane, which is detoxified and then upregulates glutathione. This, by the way, it's the same enzyme pathway that detoxifies some of the meat compounds that are charred. When you get charred meat and you get these polycyclic aromatic hydrocarbons and heterocyclic amines that everybody complains about, it uses the same exact pathway to detoxify that as we use for sulforaphane, which is found in broccoli sprouts, and it's touted as this great food because it upregulates these defense mechanisms. But the goitrogens, they potentially cause thyroid dysfunction. We have so many people that have, how many people that have thyroid issues? I mean, in your practice, I bet you see a ton of them, a lot of women.
Sure. Yeah.
And we have these autoimmune issues. Hashimoto is probably one of the more common autoimmune syndromes way out there. Could it be related to diet? I don't know. I mean, that's an interesting thought. But I mean, when we look at the biochemical requirements to run a human body, you need essential fats, you need essential amino acids, you need vitamins and minerals. You don't need phytochemicals. You don't need fiber. The other thing that's kind of interesting, and it's not talked about much, but actually in animals, in meat, they actually absorb and bioconcentrate some of these phytochemicals or phytonutrients, if you want to call them that, in their actual tissue. And I've interviewed a number of guys that, depending on how they're fed, you can actually get some of these compounds from eating animal products, interestingly. So it's and animals eat a much greater diversity of forage in general than you and I do in greater amounts. I mean, if you look at a cow, what a cow's eating a day, they're eating, 40, 50, 60, 80 pounds of food a day. I don't know. I know gorillas are eating like 50 pounds a day, and I think a cow would probably eat orders of magnitude more than that just based on size, but or maybe 5 times as much based on size. But so they are storing some of that up there, and they're bioaccumulating some of these compounds. So you get them secondhand anyway.
So I know another question people are going to have is, since we're talking about vegetables, is don't you need the fiber? How are you going to poop? Or aren't you going to be constipated without fiber? What would you say to that?
Well, I mean, you could assume I haven't had a bowel movement in 4 years because I haven't, and that's not the truth. I mean,
Right.
Even people that are fasting, right? You have people that don't eat anything and they still have bowel movements, right? And we look at what makes up, the composition of a bowel movement. It's it's bacteria. It's, sloughed off cells from the digestive tract. Those are the primary constituents. There's a little bit of food residue. And then, in people that eat a high fiber diet, a lot of fiber. And what we're seeing is basically all that fiber, those high-end, expensive organic vegetables and organic fruits that you eat, what percent, 50% of that nutrition is going into the toilet. So you're paying for, it's like taking vitamins and paying for expensive urine. You're spending all this money on organic fruits and vegetables, and again, half it's going in your feces, and you're not even accessing a lot of those, nutrients. There is no evidence. In fact, there's evidence to the contrary, but there's no evidence just showing that having 3 bowel movements a day or 2 bowel movements a day or 1 bowel movement a day is any more healthy than having 1 bowel movement every 2 or 3 days. I mean, I defy anybody to show me an actual RCT, not some epidemiologic associational study, but an actual real study that shows that, and it's not been done. In fact, Ann Peary published a study, I think in 2014, looking at colonoscopies, and I think she had 2,000 colonoscopies, and she stratified them in quartiles. The people with the highest amount of fiber that had the most bowel movements had the greatest amount of diverticular disease. And it was just the lower the fiber you had, the less bowel movements, the less diverticular disease you had, which I thought was quite interesting to see that. And there's several other studies out there that show similar type findings. Chronic constipation gets better when you eliminate all fiber. There's quite a few out there. But one of the more common things we hear about these days is fiber is necessary because you have bacteria that are going to convert that fiber through fermentation, short chain fatty acids, primarily butyrate. And that butyrate is going to nourish the colonocytes so they have a healthy, they're healthy and they have, a more robust mucus layer. And there is some truth to that, but we also know that, you can ferment amino acids and also produce short chain fatty acids, isobutyrate, propionate, acetate. We also know that if you're on a lower carb diet, ketogenic diet, perhaps carnivore diet, you will start producing a lot more ketone bodies. And one of those, or the main one that's in the bloodstream, is called beta hydroxybutyrate, which sounds a whole bunch like butyrate. It's just one hydroxyl molecule away. I mean, it's just a little OH molecule, which is very readily reversible. And we know that the colonocytes have a blood supply. So they have access to butyrate or beta hydroxybutyrate regardless if you get it from diet or not. And, it's just, one of these things where we have this sort of desperate belief that we've got to have fiber. We've got to have, these types of things. We try to prove that through these mechanistic, and it's a problem. Again, the nutrition science is very difficult to do because, like I said, if we were to assume that, let's just say this, fiber is essential for good health, because it does all these things in the colon. And yet we have people that have had colectomies, and they don't even have a colon, right? So the fiber's not going to do them any good. There's no bacterial microbiome interaction. And these people with colectomies, particularly the ones that don't have cancer, that didn't lose it, didn't have some sort of, advanced stage cancer, they live a normal lifespan in many cases. I mean, they, if they've lost their colon due to ulcerative colitis or something, trauma perhaps, and they have a colectomy, they don't need fiber. In fact, they do worse with fiber because what you talk to anybody who's had an ileostomy, and I've talked to several, whenever they eat fruits and vegetables, I mean, it just all ends up in the bag. Nothing gets digested. I mean, it's completely passed unchanged into their colon. When they eat meat, guess what? It's all absorbed. It's all completely utilized. And so this belief that we need this indigestible substance to stay healthy, it's kind of almost ridiculous to think, why would I put something indigestible in my digestive tract? I mean, it's like I guess you could eat rocks for the same benefit perhaps. But, fiber, it's not to say that fiber cannot be beneficial. I think that's context dependent. I think, some of it mitigates a glucose excursion, but that's in the context of a high carbohydrate diet. Like I said, if you drink apple juice and watch your blood glucose go up, it'll go up fairly rapidly. If you eat an apple with the same amount of caloric and glucose load, it's going to go up much more slowly. So it does have a benefit in that regard. But if you're eating a carnivore diet, you're not taking in the carbohydrates anyway. And then the fat is going to do the same thing as the fiber does. It just kind of mitigates any kind of glucose response.
You mentioned ketosis. I'm curious. Do you ever check you're in ketones? Are you in ketosis all the time, or do you care? Do you ever check?
The important aspect there is I don't really care.
Yeah.
I mean, I think I think it can be helpful in certain situations, but I just trying to say, what is my goal here? What am I trying to achieve with a nutritional strategy? And it's basically health. And how do I define health? Well, I define my health relatively subjectively. I mean, there's some objective things we can look at, what's your waist size? How much do you weigh? How much body fat do you have? How much visceral fat do you have? So on and so forth. But how do I feel? And is that dependent upon what my ketone level is or something else? And I'm not convinced it's dependent upon ketone levels. In fact, we know there's people that can gain weight while in ketosis. They can put on body fat. Ketosis doesn't necessarily automatically mean you're losing weight. It can mean that, and often it does. And the ketones are formed by lipolysis, by when lipolysis is occurring. But I don't regularly check that. I mean, I check glucose occasionally. I think that if you're treating a particular condition, obviously for epilepsy, which is where a ketogenic diet originated from back in the 1920s, that's a reason to maybe do that. Some people for cancer treatment will utilize it. There's probably some other situations where it may be helped. There's some thought that in mental health disorders that ketosis seems to help, and so that may be of benefit. But honestly, my sort of metrics are more subjective in quality of life, and whether if I have to check ketones every day to tell me if I'm happy or,
Yeah,
you know,
I
having
got
a
you.
good life, then maybe I'm missing the point.
Yeah, makes sense. So other questions people are going to have, I know they're going to say, okay, well, what about heart disease? You know, all this meat and the fat on the meat is going to cause heart disease. It's going to raise my cholesterol. Now you don't have to convince me about cholesterol. I'm actually going to do an episode on cholesterol at some point. You know, because I just think we have got that wrong, as I'm sure you probably agree. But I mean, what would you say about, you know, an all meat based diet and you know, the potential of increased heart disease, cholesterol, that kind of thing?
Yeah, I mean, I think the honest answer is we truly don't know. I mean, we don't have any sort of, you know, and this is one of the knocks to say, well, there's not any data. I mean, there's data on standard American diet, which is
Hmm.
basically a little bit of meat and a whole bunch of junk food. And we like to point
Hmm.
the finger at meat. But I mean, I think every RCT that's ever been done looking at meat does not come to the conclusion that it causes heart disease. Now, there's, again, most people will point to these epidemiological survey data, which is not a scientific study. It is plagued by tremendous confounders, recall bias, you know, the food frequency questionnaire. It's just it's kind of cluster on that stuff. But so, you know, and just this year, as you probably are aware, Journal of American College of Cardiology just came out and said, look, saturated fat from red meat, from milk, from eggs, from chocolate does not lead to heart disease. I mean, there's no strong evidence to suggest that it does. And so, I mean, really, most of the data, or I would say most, but a significant amount of the data that has come out in the last decade really kind of points away from that fact of saturated fat being the bad guy. Now, it's probably neutral, you know, is what
Hmm.
most people would say that are familiar with the literature on that. And again, we have to look at the context of where you're getting saturated fat. Is your saturated fat in a muffin? Is it in a Twinkie? You know, where are you getting? And you know, I would argue the vast majority of the saturated fat that many Americans eat are getting it through some of these processed food. Now, dairy is pretty
Hmm.
high in saturated fat. That may be a different topic. And the majority of the animal products in the American diet tends to come from dairy. I mean, red meat, just so people understand, well, beef in particular, the average American eats around 2 to 2.4 ounces a day. That is an abysmally small amount of beef. You know, you think about how much 2 ounces is. I mean, it's just a tiny amount. Uh, Back in 1977, you know, the Americans had peaked in their beef consumption. I think it was around, I want to say it was around 96 kilos per year, might have been pounds per year per person. And now it's down to around 55, 56, something slightly gone up in the last year or two. But we've had about a 40% reduction in the amount of beef we eat in the United States since the 70s. And with that red meat going down, did we get thinner and healthier and less diabetic? Not, no, absolutely not. We went the other
Yep.
way. So it's kind of just ridiculous to point the finger that way. But there's a lot of I think ethical bias towards, you know, demonizing meat, unfortunately.
Yeah. So I'm curious if you even monitor your cholesterol, because if you were my patient eating how you do and you come in and you know, we were to check labs, and I'm sure you have a really low fasting insulin, I'm sure you have really low triglycerides, um, you know, and you already said your calcium scores zero, your inflammatory markers, I'm sure, are zero. So with all that, me personally, I wouldn't really care like what your LDL is or your overall cholesterol is. Uh, is that something that you even monitor on yourself?
I've looked at it a couple times, and you're pretty right. I mean, you know, basically, you know, I saw a slight elevate. You know, in fact, quite honestly, and I haven't checked labs a tremendous number of times, but the time I had checked my cholesterol, maybe 7 or 8 years prior, my LDL and total cholesterol didn't move much at all. It didn't change much at all. What did happen was my HDL went up a bit, about 20%,
Yeah.
and my triglycerides went down to like 50. I mean, it was very low.
Yeah.
So inflammatory
Yeah.
markers low, insulin low, all those types of things. You know, LFTs fine, kidney function fine. More importantly, like I said, that coronary artery calcium scan being zero. I mean, what I tell people, I don't totally disregard cholesterol because I do think LDL cholesterol, I think, you know, as a screening tool, you know, you can utilize it, but then you have to ask the question if you're a, and again, one of the problems with the modern medical system is, you know, you've got 15 minutes as a luxury to see your patients. A lot of physicians are seeing
Right.
them, you know, one every 6, 7 minutes, but you know, you get 5 minutes, 8 minutes with your patient between EMR and coding and billing and all the other junk that goes into that and stuff. So you don't have a lot of time to get into the nuance. And so if the LDL cholesterol's up high, you say, a lot of people say, well, 88% of the Americans are metabolically unhealthy. Let's tell them to go on a low-fat diet and take a statin. And that probably covers you 90% of the time. But now we've got this growing group of people that are generally metabolically healthy, and it's a different cohort. So I think you have to look into that. And so I think rather than risk factors, and there's many of them, as you know, I mean, CAC score, age, sex, smoking history, family history, diabetes history, blood pressure, all those things that you can roll, the triglycerides, you can roll all these things into there, whether it's oxidized LDL, particle size, but that takes more time and more nuance. And you have a physician that's engaged or even knows this stuff. Many of them don't even know this stuff, but I prefer to look, if somebody has that, if somebody tells me, hey, my LDL cholesterol is 300, I'll say, hey, it may be fine. I think it makes sense to be prudent, make sure all those other markers are looking good. And then you can survey it with coronary artery calcium scans, provided you're old enough, over age 40 or 45, depending on who you listen to. Perhaps maybe CIMT scores on the neck might be another way to kind of monitor things, because that tends to be a little more dynamic. You can see if there's, do we see plaque in between the intima and the media? And you can kind of monitor that over, and that changes month to month at least. And so you can kind of get an idea of monitoring disease. It makes more sense to look at disease rather than, risk factors to me.
Yeah. Okay. So another question, people are going to have is, okay, what about a potential increased risk in cancer? And I'm going to take that a step further and get in the weeds a little bit. I'm sure you're probably familiar with Walter Longo, and he's done some studies on mTOR, and he'll say that increased protein increases mTOR, which is then going to increase your risk for cancer. Obviously, on a carnivore diet, it's very high protein. What would you say about the mTOR, and then just cancer risk in general?
Yeah, specifically, so the study that Longo is sort of basing that on, the only human study, is a study that I think he was the primary author or the senior author, and Levine was the first author on that. And that was, they harvested NHANES data, and this is the repository of what people eat in the U.S. And there was some severe criticism levied about that study. And one of the guys, Don Layman, who's one of the world's leading researchers in protein, basically protein in general, muscle building, protein metabolism, protein biology, Stu Phillips and about 10 other authors, authored a letter and said, look, not only is this paper bad, it is probably one of the worst papers ever published. They completely botched the NHANES data. They selectively chose what they did. They had statistical outcomes which were completely impossible. I mean, these are just like, there's no way these things can be true. And then they had the opposite conclusion. If you're in midlife, 40s, 50s, and you eat a high protein diet, you're 400%, it was like 73 times likely to get diabetes or something along some ridiculous number, 400% a lot more likely to get cancer or shorten your life. But then magically, once you get to 60, it reverses. So it's like, what is the biological plausibility or mechanism for that happening? And so they authored this lengthy, and I actually have the criticism. I've got the letter they wrote. They sent it into Cell Metabolism, the journal that was published in, and they refused to publish that, that critique, partly because Longo sits on the editorial board and they refuse to publish that. And so that study, again, outside of that study, there's really no human data. In fact, there's so much human data to show the opposite. But basically they've got studies on nematodes and mosquitoes and fruit flies and a few rat studies, which are not good proxies for humans when it comes to longevity. There's so many problems with that. But if you look at the data we know what happens when you restrict protein, particularly as people age. They become sarcopenic. They become frail. They have fragility fractures. They have their organs shrink. It's just a disaster. This is the American nursing home system. You see all these people that are protein deficient and they're just incapacitated with function. We have so many studies that show that maintaining skeletal muscle mass provides function, protects our bones, prevents cancer, prevents heart disease, improves neurocognitive outcomes. So this is just, to say to limit protein. Now, the cancer in general, the biggest thing everybody focuses on is this 2015 WHO IARC proclamation that red meat is a class 2 carcinogen, processed meat is a class 1 carcinogen. And again, that study, it was I think it was, I can't remember, it was a 22 member panel or something like that, met in Lyon, France, and did this in 2015. And the problem with that is almost all of the recommendation came from epidemiology. I've talked to several of the people that were on that panel, and David Clearfield, professor, has been doing his whole life, sat on the panel. And this was not a unanimous decision, by the way. There was a lot of dissent. He said this was the most frustrating process he'd ever been to, because they just completely ignored any study that would point away from red meat causing cancer. I mean, they just flat out disregarded it, threw it out, didn't even want to look at it. About a third of the panel were ethical, vegan, vegetarian, Seventh-day Adventists. They did not disclose that information. He asked for it to be disclosed. They said, no, it's not important. We're not going to do that. Since that 2015 position paper came out, there's been several systematic reviews of red meat, one done in 2019 by Nutrirex, 14 authors from around the world, notably, what's his name now? I'm blanking on his name. It'll come back to me. But anyway, out of McMaster's University, he was a guy that basically invented the term evidence-based medicine. And, in 1991, he actually invented evidence-based medicine, and he was one of the senior authors on this paper. So he basically went through and looked at the evidence and said, there's no strong evidence whatsoever to, lead us to believe that red meat causes heart disease, cancer, or really anything else that has been on it. Any study that suggests that is extremely weak. So we don't really have good data to show that that's going on. And if you look at the Asian data, even the epidemiologic data in Asia, again, when we look at Western dietary patterns in its consumption of red meat, it's often, the classic hamburger, French fries, Coca-Cola, the hot apple pie type of thing, McDonald's classic junk food meal. And it's very much confounded by all those things. But when you look at how the Asians eat meat, it's usually some sort of vegetable thing or something like that. So they're not eating the junk food with it. And in their data, when you look at the epidemiologic data out of Asia, which is about 15% of the data, almost no relationship, overall. There's most of the studies point to no relationship or an inverse relationship with red meat and cancer. And so these, if you look at everything subsequent to 2015, numerous studies now point to the fact that this is just, there's nothing there outside of epidemiology and a couple really poorly done rat studies. So I would just challenge the fact that red meat causes cancer. Now, what you eat with it, perhaps, and some of the other lifestyles that are associated with that, the fact that people that eat more red meat, die more frequently in auto accidents. Does red meat cause auto accidents, or is it just a lifestyle? Do they drink more? Do they smoke more? Do they not exercise? Do they let themselves get obese? Do they go to the doctor? Do they, healthy user bias is a tremendous confounder here.
Yeah, very good. So who do you feel would benefit most from a carnivore diet? I mean, I feel like it's kind of the ultimate elimination diet. And so the people I've been encouraging to try this is, like autoimmune patients who have maybe felt some other things. That's kind of where I'm starting and kind of opening the door to this. But is there a certain subgroup that you think would benefit more than others?
Yeah, I mean, I think that autoimmune group is definitely a good place to start. I would put some of the GI disorders, I mean, obviously ulcerative colitis and Crohn's disease, also autoimmune diseases, but they're primary gut diseases. Some people with IBS, irritable bowel syndrome, which is, as you're probably aware, is growing in prevalence. I mean, I think we've got something like 15% or maybe 20% of the population now carries that diagnosis. I think in Mexico, it's like 40% of the population. And so I think those two are pretty interesting places. What I'm really surprised, we see quite a few people with refractory mental health disorders getting better. I mean, I've seen chronic depression, anxiety disorder, bipolar disorder, even PTSD benefit from this to a large degree. So those are the people, again, I have never advocated that all people need to do this. I'm not going to say it works for everybody. But what I will say is, for many people where, as you see a lot of people, you get these patients where they've got a med list, 2 pages long and an allergy list just as long. They've been to 7,000 doctor's appointments and specialists, and they get bounced around.
Mm-hmm.
Nobody wants to do anything because they're like, you just see these people that they're just lost causes, and it's like, you
Mm-hmm.
can't do anything for them. Those folks, I think, would benefit from it. I think that, I mean, certainly it helps with diabetes and metabolic syndrome and obesity, but a lot of things help with that. And so this is people, I think there's a lot of things people can do outside of a carnivore diet to lose weight, to improve their diabetes, to improve their glycemic control. Many of those tend to be low carb options, but the extreme elimination of a carnivore diet, I think, is something that where you got these tough cases. And it's not to say these other people can't do it, because it becomes, I think, I almost use it, I like to call it a kind of a reset. It's kind of like a physiologic reset button. Like when you're a baby, you're eating basically an animal-based diet. It's breast milk for the first, wild humans, indigenous humans do it for about 2.5 years on average. Most modern people, 6 months a year. But we start out on this sort of clean slate, clean, functioning organ systems. And it's not till later in life that everything starts to break down. Unfortunately, we're, as you probably aware, we're seeing kids 6, 7, 8 years old that already are on their way to obesity and diabetes and insulin resistance.
Sure.
But I think it's a reset button, and I think it gives your gut. It's a wonderful rest for the gut. It's a place you can kind of leave from and come back to as you need to. So a lot of people, in my experience, probably 90% of the people that do this diet stay about 90% strict. And I think that's, because it gives people a little bit of room to, I want to have this and that every once in a while. And it's not a doctrine. It's not a cult. It's not a religious thing. It's not reverse veganism, where veganism is very much ideologically driven, where if you so as much as think about smelling, some cooking meat, you're all of a sudden an evil person. This is not like this. I define this diet as animal-based. Get your nutrition there. You limit or eliminate the plant foods as necessary for health. Some people need to fully eliminate. Other people, it's a little bit of limitation, and you just kind of see where you land, and you just kind of experiment there. But I think there's not too many people, I think, that couldn't benefit from it. But I would say for the people that it would be something would be ideal for them is probably a smaller subset.
Yeah. My goal is to kind of do a carnivore-ish diet. I've been probably kind of keto-ish for, I don't know, a couple of years now, and I don't have any health problems, so I just do it to be healthy. I don't have really any problems whatsoever. But the more I read about carnivore and the more I learn, I do really think it's a healthy way to eat. I don't know that I could be super strict. I really like my coffee. I like my occasional beverage, and even occasional sweets. And so, I don't know that I could be that strict, but again, I don't have, any health problems to motivate me to be strict. So, is that what you say most people would do? Maybe kind of a carnivore-ish?
Yeah, I think that's fair to say. I think, I surveyed, I did a survey a few earlier this year, and I got something like 12,000 responses within 24 hours of people doing it. And we had people of different durations and different sort of strictness, from starting at 70% up to 100%. And what we saw is, first of all, from duration, the 3-month point seemed to be the inflection point where people were seeing improvement. When you get to 3 months, it was dramatic improvement for most conditions. We asked a whole plethora of things. And then, for how strict they were, 80% was better than 70%, 90% was better than 80%. And then from 90% to 100%, there was still improvement, but it wasn't, as big of a jump. And so it was kind of like, it was like, it's kind of levels off the closer you get, but there still is a slight improvement. And, it may be these people that are strict autoimmune issues that kind of do that. So, I mean, I do think there's room, and I would say 90% of the people end up doing about 90% strict, and they realize they feel great, but they're like, hey, I want a piece of birthday cake every once in a while. Sometimes I want some avocado or some blueberries or whatever. And I don't, that's fine. I'm saying if it works for you, and I tell people, just be objective and, just, and like I said, and even if it bugs you and you're willing to live with that, you might say, well, I'm going to go out and, have some other stuff, and, I'm going to have gastrointestinal issues for a day, and I'm okay with that. Hey, that's fine. If that's your deal, that's your deal. Other people are like, I have a meeting every morning with this MeterX company we have. And we've got thousands and thousands of members, and many of them show up every morning at 9 a.m. I do a meeting with all the members, or sometimes it's a podcast. But and I ask people, we've got some folks that are like, man, I'm 100% strict, and if I deviate in a little bit, I get crazy. I've got a guy that's got this chronic lifetime depression with psychotic features. If he just eats beef and bacon, he's a happy man and everything's good. Something else gets in there, it's like his symptoms start coming back. We see a number of people, and then we have some people that are kind of like, hey, I do carnivore, and I'll throw some spices on my food, or I'll make this little recipe, and sometimes I'll throw a little this or that in there, and whatever. It's all fun.
Yeah, but I imagine if you're trying to treat an autoimmune disease, I mean, you probably need to be pretty strict, though, right?
Yeah, that's how I approach it. And I think, and the other thing is we're developing some machine learning models to look at, as we get more and more data within our community. We're seeing, who needs this and that, and sometimes it's a fat to protein ratio. There's some differences in how whether you go into ketosis, whether you eat a higher protein, and there's different people that do better different ways, and so the things we lean. But I do think, yeah, if you're dealing with an autoimmune disease, I think there is some definite benefit from being very strict for at least a discrete period of time, somewhere like 3 to 6 months, to see if you can seriously impact this, and then it becomes, what can I add back in, and how do I do that? And I think there's a system to doing that.
Okay. So on that note, how can people get started if they're interested in trying this? What's your recommendation? I mean, do they just stop cold turkey everything, or?
Well, I mean, I think there's definitely some ways to transition into it. And I think people, first of all, I want to say, if you are fairly sick and on a lot of medications, and this goes for really any low carb diet, really, you probably need to involve your healthcare provider, because some of these diets, I mean, they can dramatically decrease your requirement for things like blood pressure medications, certain diabetes medications, even some of the mood medications. So you need to get with your prescribing physician or healthcare provider and say, hey, look, I'm going to be going on a low carb diet, carnivore diet, whatever you want to call it, and just get some support, because you may find that your blood glucose is bottoming out, or your blood pressure is bottoming out because you're on too much medication. So that can happen within a few days, and so there's a caveat there. But I think that, for some people that are particularly like big time, sugar addicts, just very physiologically dependent upon glucose, you might find that a transition period works, and then going strict, because it's kind of like almost kind of recovering from an addiction for some people, and it's kind of like one of those things. It's like you wouldn't tell an alcoholic to, give up alcohol except for, on the weekends. You can have a couple on the weekends. That's not how that works. And so you have to kind of detox these people, or, get them off the problematic issue, and some people will say sugar is a drug. Other people will push back pretty hard on that. But regardless, we see a lot of people struggle with that. And so sometimes it's just doing that. I know, like I said, I'll just say this again, MeterX is a resource that we've created that has basically everything you're going to need to transition to the diet. So you can go there, join for free. If you stick around after a month, you can continue to do that. But we've got coaching, we've got, recipes, we've got resource materials, research articles, testimonials, just everything you're going to need to get started, FAQs and so on and so forth. My book just outlines a lot of the stuff, where you can go. I think one of the things I've learned is, knowledge is great, and a lot of people say, well, it's not our house to eat meat and water, but a lot of people end up with questions, and things start to happen physiologically, and they want to be reassured, or get somebody with some experience. Sometimes some weird things happen that unless you've had experience, you're not sure what to do with that. And so support becomes very helpful, because when you're going on a carnivore diet, the usual answer is, well, the physician's not going to like it, the family may not like it, you get isolated, everybody's telling you you're going to die, you're going to have a heart attack, your colon's going to fall out, yada yada yada, you're going to get whatever, your kidneys are going to die or something. It's, all this stuff is not based on any real scientific truth, but it's just that popular sort of nutritional dogma that's out there. And so support becomes very important. So get somebody that can support you. And that's another one of the services we provide over there. So I think that's been one of the lessons I've learned.
Yeah. And I would tell patients too, anybody that's interested in this, and obviously if you're my patient, I'm going to be very supportive of this, but I don't know how it is there, but there's a lot of physicians around here that just aren't supportive of even a ketogenic type of a diet, and especially something much more extreme like carnivore. And so I had one patient that had started on a keto diet. Blood sugar was great, had gotten off a lot of medicine, was feeling good, blood pressure was down, went to see a specialist, and I can't remember, it was either a cardiologist, endocrinologist, I can't remember, and they said, you need to get off that ketogenic diet. So they came back to me and they said, they told me to get off the ketogenic diet. And I said, let me get this straight. Your blood sugar's better, you're feeling good, you've lost weight, and they want you off. Did they say why? No, they just told me to get off. And so I say all that, if your doctor, not that you shouldn't listen to your doctor, but if you have a doctor that says, oh no, don't ever do anything like that, just do your research, I guess is what I would say.
Let's say get a new damn doctor. That's my, and we, like I said, we've got a big
Yeah.
list of them on our site. But I mean, and that's the thing. I had a patient that was,
I wasn't going to say it like that, but you did. So
yeah, I mean, well, I mean, that's fair
yeah,
enough. I mean,
no, I'm just kidding.
I don't care at this point, but I
Right.
mean, I care, but I don't. I'm not worried about offending people. But I mean, I think that I had a guy joint replacement, and I put him on a ketogenic diet, and he was like 380 pounds, and he dropped 80 pounds in like 3 months. And he went to his internal medicine doc who he'd been seeing for 20 years, and the guy
Yeah.
asked him what he was doing, how he lost weight, and he said, no, that's dangerous to lose that much weight. And he came back to me and told me this, and I said, you've got a doctor that's been seeing you for 20 years and you haven't lost a pound. In fact, you've gained 100 pounds, and he's telling you it's dangerous to lose weight because of the diet you're on.
Yeah.
Just insane.
It's a,
It just boggles the mind.
it's a
Yeah.
crazy system we're in. Yeah, it
Yeah. I
is.
mean, you've got a happy patient that is smiling and feels good, and all of a sudden you're telling him stop doing that. It doesn't
Yeah.
make sense.
Yeah. So what is a daily, you know, diet look like for you? Like what are some daily meals for you?
Yeah, for me right now, well, I mean, it depends on what I'm trying to do. Right now, I'm trying to gain weight, so I'm eating like
Okay.
a horse right now. I'm eating 5,000 to 6,000 calories a day,
Wow.
over about 3 meals. It's usually a couple pounds of steak in the morning. Maybe I'll have an omelet, eight or 10 egg omelet with some bacon and cheese in there. Afternoon might be these chaffles, which for those people that don't know, it's cheese and egg. So usually it's like my recipe, it's 3 eggs, a cup of mozzarella cheese, a little bit of salt, throw it in a waffle maker, press it down, and then I'll throw some sandwich meat in there, some lunch meat or hamburger patty, and then just kind of toast it in the pan in the grill and some butter. Dinner will be maybe some fish, maybe some more steak. And that's kind of a typical day for me right now. And so outside of that, when I'm not trying to gain weight, because right now I'm actually eating beyond what my appetite would dictate, it would be 2 meals a day, almost 90% of the time. It'd be kind of a latish breakfast and an early dinner. I tend to eat in a relatively compact window of about 8 hours. Partly because I just don't like eating too late at night. When I eat a lot of food late at night, I don't sleep as well. I think there is some decent circadian rhythm science out there that would, or circadian biology science out there that would tell us that there may be some better times, some beneficial times eating earlier in the day, as opposed to later in the evening, but I think that's probably a minor component, but that's what I seem to do better with.
So are you got a competition of some kind coming up? Is that why you're trying to gain weight or?
Well, I mean, I spent this year, so I'm 54. I'm about to turn 54. And then I spent a lot of this year getting lean, because people say you really can't get lean on a carnivore diet. So I got just shredded. I mean, I got the leanest I've ever been in my whole life, best shape I've been in my entire life at 53. And I lost a lot of weight. And I'm like, well, I need to put it back on now, because I want to make sure as I get, the next, I think it's important. I think muscle is such a valuable metabolic capital that you need to make sure you maintain that, particularly as I'll be going into my 60s not too long ago. I want to make sure I have a decent baseline to start with. And so, plus it's fun. I haven't trained for strength and size in about a decade. And so it's kind of like I've been just kind of maintaining and doing aerobic stuff and doing some strength training, but it's kind of just for me, a little bit fun, just try to put on a little size and see what we can do in our mid 50s. And
Yeah,
again,
very
because
good.
the people are saying, well, you got to have carbs to put on weight. And I'm like,
Mm,
no, that's not what the science says. It's not what my experience, it's
mm,
just, it's protein and it's calories. And
mm.
it's just eating enough and eating enough protein. It doesn't have to be carbs. It can be fat. It can be wherever you're going to get your calorie source. Obviously fat's easier to get calories from than it is protein, but
Well, what about people who are going to say, "Well, I can't afford that, man, because it sounds expensive to eat a bunch of steaks every day." So, is there a budget friendly
sure.
carnivore diet?
Absolutely. I mean, this is a thing, and I wrote this in my book, in fact. Um, we have, I mean, we have a disaster of metabolic disease looming. We have diabetes. And as you probably aware, that's going to turn into a dementia epidemic as all these diabetics become 60 and 70 and start having dementia symptoms. Um, the solution, I mean, it's hard to go into any town in America and not find a hamburger store, McDonald's, Wendy's, or something. I mean, and it's cheap. It's not expensive. I mean, you can go to McDonald's and get literally a pound of beef for a couple bucks cooked, and you just don't eat the bun and you don't eat this Coca-Cola and all that crap. Just get burger patties if you want. Throw some bacon on there, maybe a little piece of cheese if you feel like it. You can buy ground beef. You can do eggs. It doesn't have to be grass-fed. It doesn't have to be grass-fed. It doesn't have to be organic. I mean, there are environmental benefits to doing that. I certainly support regenerative agriculture and some of these things, because I think it's, from a sustainable standpoint, it makes sense. But from a human health standpoint, again, I've seen so many people get better eating Walmart meat and cheap bacon, and they get off their diabetes meds, they lose weight, they get off their psych meds. It just works. And so it's not as complicated as some people try to point out. There's some people will say, well, you got to eat only the finest and you got to include these organs in there. I mean, that's just not what actually works at the end of the day, and I'm more interested in the results and the real human outcomes rather than some theoretical um, beliefs, rather than some, feel good narrative. I mean, that's great. And I support that stuff. But at the end of the day, what works for, what's going to work for some, if the only way this were to work, if you were to eat 6 ounces of liver 3 times a week and 3 ounces of kidney once a week and 2 ounces of brain once a week and 2 times a month eat some thymus, and oh, by the way, it all has to be regeneratively raised and grass finished. No one's going to do this. But if we say, hey man, you can just go eat ground beef in a tube from Walmart, you know 7 days a week, if that's all your budget allows, and you throw some eggs in there, and once in a while you have a steak, and it does work, and it works for the majority of the people, that's fine. I mean,
Okay.
we can figure out the environmental issues and some of this other stuff later, but at the meantime, let's help as many people as possible, regardless of their socioeconomic status. And I think that's a message I try to get out there. Yeah, you might be able to tweak and turn a few things, but if you take somebody who's metabolically broken, sick, just kind of checked out of life because of their health conditions, you can bring them back without spending a ton of money. And I think that's a great thing about this. And like I said, we can. And again, I try to work on improving the food system through getting information out there, and that's something we can work on later. But if you got a bunch of sick people, you ain't getting nothing done.
Okay. Well, what about organ meats? I mean, do you incorporate organ meats? You said it's not maybe necessary, but do you recommend it?
Well, personally, it's not a priority for me. I mean, it's not that I've never had organ meats. I've had them, occasionally once in a while. I don't personally find them palatable, quite
Okay.
honestly. I don't know. And I think maybe it's just one of those things where some people taste it different than others. We have low and high tasters, and some people, when they eat asparagus, their urine smells, and some people don't. It's just, so I think there's some folks that enjoy it, they truly do enjoy it, others that don't. So again, survey data: 12,000 people doing the diet, 15%, 15% eat organ meats on a regular basis. 85% of the people do not eat them at all or eat them very infrequently. And I define frequently as at least once a week. So I mean, there's some people that eat once a month or never. Outcome differences is none. We can't find any differences in outcomes with regard to coming off medications, losing weight, improving, diabetes markers, blood pressure markers, so on and so forth. So it's not to say that you shouldn't eat it. It's not to say that you couldn't benefit from it additionally. I think it's something individually should try it. But those out there saying you must do it this way or you're going to have problems, I think the data doesn't support that. And I'm not going to say that and say you must do it this way, or you're on the JV team, or
Yeah. Yeah.
you're not optimal, because that's just not what I've seen,
Yeah.
observing. I probably observed more people than arguably anybody out there.
Yeah. And I don't think we can be too dogmatic, like you said, or else nobody would do it. So yeah, I think that's fair. So, uh, as we wrap up here, you've heard probably thousands of testimonials. Is there one that maybe sticks out in your head that you could share that just was maybe like an amazing transformation on carnivore?
Well, I mean, I think we've got so many people with these tremendous weight loss stories and autoimmune recoveries, and it's mental health recoveries, and infertile women be having babies and all that stuff. But I mean, and those things are great and wonderful, and we've got almost 600 of those testimonials on our website at MeterX, all categorized by section, health condition. The thing that really sort of shocked me the most is we have another physician. She's an emergency room physician named Dawn Layton. She had Ehlers-Danlos syndrome, which is a collagen disorder. It's a genetic collagen disorder, which leads to hyperelastic skin and joint instability. And she was in her mid 50s, and as an ER physician, she would start out every day with anywhere between 2 and 4 joints completely dislocated from sleeping. So
Wow.
she'd wake up in the morning, have to put her ankle back in place, put a shoulder back into place, and then she would go to work, and 50% of the days, one of her joints would pop out of place while she was at work, and she'd have to stop and put her joints back in place. This was her life. And as this is progressing, and she'd had it her whole life, as this is progressing, she's starting to develop arthritis and pain because of so much trauma from the joints subluxing, dislocating all the time. She went on a carnivore diet. Within 1 month, joint dislocations went to none, 0. A year later, still 0 dislocations. She's back in the gym, lifting weights, doing full squats, exercising. Pain is all completely gone, has lost 30 or 40 pounds because now she can exercise. And this is a genetic disorder. And I'm like, I'm trying to figure out the mechanism by which this would help. And, I guess, you could say there's maybe some epigenetic modifications, perhaps, maybe improve the collagen quality somehow through, dietary modification, maybe providing the framework to build that through diet. We do have, when it comes to collagen, we do have actually gut transporters for both hydroxylysine and hydroxyproline. And I don't know if you remember your biochemistry, but those are the things that vitamin C acts upon to help, build collagen. So I don't know. I thought that was one of the most sort of shocking things to me as a physician. When somebody says they reverse their diabetes, I mean, that's like, that's run of the mill. I lost 100 pounds. No big deal. That's, that's old news. But some of these things are just, just amazing.
Wow. Fascinating. Well, okay. Well, I always end my podcast by asking my guests to share one health tip with us that can just make us healthier today. I know we're talking about the carnivore diet, but you can say that or just something else. What would you give us?
Well, I mean, I think the first thing, the health tip would be to start to take an active interest in your health. I think that's the biggest thing. And most people don't. I mean, most people are kind of passive about this. Don't outsource your health, whether it's to your family, your friends, or even your physician. I mean, you are the primary one that's responsible for your health. And, like I said, I mean, as a physician, you've got 10 minutes with a patient every 3 months or so. I mean, you live with yourself 24 hours a day. You got to walk around in that body. You're the only one that's responsible for that. I mean, you can get some help and support and some direction, but you've got to take it into your own hands to do that. And don't be afraid to assess what works. And don't listen to me. Don't listen to anybody else. Look in the mirror. Be objective about what works and try it. Be willing to try different things, because I mean, we have a problem. Whatever we're telling people, either they're not doing it well or it ain't working. And so I think we have to do something different. And I'm not, I think, if you need to make a big change and you need to change things in a big way, and it may be going on an extreme elimination diet or some kind of exercise routine, I don't think that, moderation and walking, taking the stairs instead of the elevator is going to do a whole lot.
Yeah.
in the long run. I think you got to be more aggressive than that.
Yeah. Yeah. I couldn't agree more. Well, very good. So the book is The Carnivore Diet by Shawn Baker. Website is meatrx.com. Are there any other places people can find you or resources?
Well, I'm pretty active on social media, so I've got I guess most of the major social media things. Although I'm kind of a little frustrated because we are seeing more and more censorship, even in the diet world, which is a little frustrating. We see some shadow banning and that type of stuff going on. But I am on Instagram, Shawn SHAWN Baker 1967. Twitter at SBakerMD. I've got a YouTube channel which I'm currently unable to load videos to for some reason. I'm not sure what's going on with that. I just started on this new platform called Parlay, Baker Shawn 67. And so, I just try to get the message out there. I'm not political in any way, but I'm just trying to, let people know there's an alternate theory, and there's a lot of results, and I'm results oriented more than anything, rather than dogmatic or, theoretical. I just want to see people what counts.
Yeah. Well, I always like talking to doctors who are challenging the status quo because, like you said, obviously that's not working. So, but all right. Well, thank you, Dr. Shawn Baker, and thank you guys for listening. And we will talk to you guys next time.
All right, Dennis, I appreciate it, man.